Hey everyone, I'm Kennedy Stakely. I went to UC for my associates, then my bachelor's. As a new grad nurse, I worked on the cardiac pulmonary ICU at CMC Memorial. I worked there for about 3 years. I was their night shift charge nurse. I learned a lot. It was a very critical floor. I learned so much. It was my favorite place I ever probably worked. I left there, decided I wanted to try management, so I did the clinical coordinator job on 4 West. I learned that management wasn't what I wanted to do and I wanted to go back to school, so I applied here to do my master's. And now I work at Select Specialty Hospital. It's a critical illness recovery hospital. The patient population is a little bit different, but we still do get some pretty sick patients. Family-wise, I have a 7-month-old baby. My husband's an electrician, and as I go through this program, I don't really know where I want to work when it's over. I'm interested to go through the clinicals and go through these classes and learn about each different. I've never done pediatrics. I've never done women's health. I do think that the women's health does intrigue me, and I'm interested to learn more about that, and the pediatrics, really, just to see what I think I might like. The goals I have for this class, I would like to learn to think like an advanced practice nurse rather than a bedside nurse. I think that's going to be one of my hardest things to learn, is how to switch that into a bedside nurse logic to think like a advanced nurse when I'm talking to patients or making, plans for the patient. My second goal is to learn about the role of nurse practitioner versus a doctor. I've worked alongside many nurse practitioners and doctors, but I feel like I need a clearer, I need to know exactly what a nurse practitioner can do versus what a doctor has to do that the nurse practitioner can't do. Like what kind of orders can be placed by what a doctor or a nurse practitioner, and things like that. I think it'll be interesting to know the exacts on that. But I'm glad to be here, and I'm glad to meet you all.